All right, so, I mean, I'm here to answer any kind of questions. If you want an update on the number of cases and stuff, I'm more than happy to provide that. That would help you. Is that what you want? Yeah. So to date, we've had 4 COVID-19 cases confirmed in Miller County. Of those 4, 2 have already recovered, and they're fine. The third one will recover within 2 or 3 days here, maybe even tomorrow. I'm not sure. And then the fourth one we just learned about last night, and the investigation's ongoing. We have the number of close contacts associated with that case, so who knows what'll happen, but that's part of it. That's one of the interventions that we use to stop the spread of disease is interview infected people, elicit their close contacts, and then notify those contacts if they come into contact with the virus, and then apply quarantine orders, get them tested, that kind of stuff, to try to stop the spread. So if you put together all the cases reported in Camden, Miller, and Morgan, we've had a downward trajectory of cases for over 6 weeks now. So that if you use the White House's reopening plan that was released before the state of Missouri's, then you take that and you combine the ability for the healthcare system to respond to the pandemic. You got to have appropriate levels of testing. So there's just a variety of these gates that needs to be met in order to move from phase to phase. We were probably well into phase 1 before the guidelines come out in this part of the state. But we don't have any barriers right now for anyone to get tested around here. All 3 hospital systems offer testing. Our federally qualified health center, which is St. Ozarks Medical Center in Osage Beach, and then they also partnered with Eldon School, so they got the clinic here in town at the school that that offers testing. If there's anybody that needs to be tested, can get tested in our community. If they don't have funding for it or insurance, that can be worked out. St. Ozarks Med Center serves all kinds of people, and even the health hospital systems has assistance for folks. So testing rates, when you look at per capita, the number of people tested per the number of people that live in the county, our rates are higher than our surrounding counties when it comes to testing, the number of tests performed. So, we have all the confidence, along with Morgan and Camden and Cole and Pulaski, to move forward with reopening. Montauk is hesitating a little bit because they do have an outbreak within the pandemic in one of their meat processing plants, and that's nearing the end of that particular outbreak. But we know that when we reopen, we will have additional cases. It's just part of it. We all have to remember why we did this intervention. It's to, what you've heard a million times, flatten the curve or slow down the number of people that are infected at one time, so our healthcare system can respond to reduce that burden on that system. And so we've been successful here. We know that removing some of these restrictions will result in additional spread, but that's something that's acceptable. So, especially now that we have testing readily available, because that would be the very first intervention that we would apply. We would test people and aggressively do the contact tracing. Since that strategy was not available at the beginning of the pandemic in this country, we focused on the stay-at-home and spacing interventions.
Is there any other questions that need to be pass it to Michael.
So, I mean, I provided a document there because I know your topic's about playing ball, doing recreational activities. And so I provided, at the top is what CDC's current guidance is. Of course, it's a blanket guidance for the entire nation. And then, it says to, seek guidance from state and local authorities. So then I included the state's guidance. I provided the most current order from the governor. And, it does not prohibit any kind of outdoor activities or any kind of mass gatherings at all. In his question and answer, or his FAQ page, there is a question about athletics and sporting events or something. So I pasted that answer on that document. And then I included our guidance, which is the exact same guidance. We partnered with Cole County, Morgan, and Camden County to ensure we're consistent throughout our community. And again, Montauk's, they'll relax pretty soon, but right now they don't want to have any kind of social gatherings there. And of course, that's for the month of May. So if you guys are talking about June and July, we anticipate that the governor's orders will become recommendations for the month of June and go from there. We would just recommend that anybody that's going to organize any kind of event to assure that the participants have the ability to protect themselves. Whatever you do, don't prohibit the use of masks. Don't require them to be in small confined spaces. Give them the opportunity to distance, just like what you did here.
I think, Michael, we have that set up that way at the current time, right, for them?
That's right.
One thing that we need to make sure that if it is authorized and approved this evening to have the baseball and softball and things of that nature, that does not relieve the parents' responsibility to keep an eye on their children for possible things that could arise because it can spread from anywhere.
Exactly. We all have
A responsibility.
the same responsibility to protect ourselves and protect others. And, and it's not necessarily the government's responsibility to protect us. We need to take that responsibility. So if you don't feel comfortable in participating in something, don't do it. If you don't feel comfortable going to a restaurant that's crowded, don't go there. That's going to continue to be our guidance from here on out. So, so we just would encourage you to have some kind of enhanced protocol in place. Something more stringent than what you've had in previous years to assure that all the equipment, commonly touched surfaces are disinfected on a routine basis. Try not to allow kids to share equipment. Let them use their own. Don't share drink and food, obviously. Have plenty of opportunities for them to wash their hands. Use hand sanitizers. Don't smash them all in a dugout. Give them the opportunities to maybe line up some chairs or something along the fence line. I've got a baseball mom employee, and she received the rules for one tournament that they're going to in Texas, and they modified the rules of the game. So the ump is 6 feet away from the catcher, and the catcher is further from the batter's box, and all the umps, there's no leadoff runners because they don't want the runner next to the first baseman, all that kind of stuff. And that's all up to the organizer of the event of how far they want to take it.
Is there any questions for Michael?
It's pretty much voluntary. If they want their kid to play, they have the choice. If they want to go to the games, they have the choice. We're not forcing anything.
I hope not.
I know, I'm like, we can't make
But
a
if they
decision
do,
for them.
if they do come to the game, they must emphasize about spacing and things of that
Yeah.
nature.
For like participant, or the observers?
Yes.
Yeah, absolutely, too, yeah.
So,
So
you know, that
signage,
is their personal responsibility.
signage would be good?
It's their personal responsibility to protect themselves from this. We'll open it up, so to do it
See, so
with
the-
guidelines.
So the current order, says us as citizens need to provide space between one another. It doesn't direct any business or organization to not do a particular activity.
But to enforce somebody doing something wrong, there really is nothing to enforce, is there? I mean, if you catch a bunch of parents sitting together or something, I mean, you can say something, but what can you really do?
Well, and you don't know if they came in the same car.
I know, I mean, they all rode
Right,
together.
right. So it's.
They all can be family.
Absolutely.
I mean, restaurants have this challenge on them as
I'm
well.
sure.
They don't know who came together, who should be sitting together or not. So that it's impossible to police.
So it's a personal responsibility.
Truly is.
Any other thing else?
I just want to say thank you for, I know I reached out to you, I know some other people did. Thank you for coordinating with us, giving us
Sure.
the information and coming up and speaking. Really appreciate it.
No, I'm here for you anytime, right? Right.
Thanks, sir.
Make a motion to approve baseball. You have something to say?
Yeah,
Okay, go ahead.
I didn't have any questions from Mike, but I appreciate the guidance that was handed out. The U.S. Centers for Disease Control and Prevention is pretty clear about postponing or canceling organized activities and sports. I totally understand that each state, each community has the ability to make their own guidelines. Eldon previously took a position based on the recommendation of our health to protect the youth of our community by increasing the smoking age. And in my mind, this kind of goes hand in hand. In good conscience, knowing all of the risks that exist from exposure, I feel strongly that we as a community are beholden to protect our youth, and I feel no compunction to allow youth sports, whether it's a source of pride, as someone mentioned to me, or that what the potential consequences to our community would be if we missed a baseball season. I find pride in protecting vulnerable populations, and I believe the potential consequences of opening our youth and frankly all of our citizens to this type of activity far outweigh the potential consequences for missing a baseball season. I think it's unfortunate that we're all in this position, but I feel strongly enough to state exactly how I feel about this, and my opinion hasn't changed. I personally will do everything I can to prevent the spread of this disease. I don't want on my conscience potential safety and health of our citizens.
Any other comments?
Daphne, I can understand where you're coming from, and I understand that nobody wants kids to get sick. But
I don't want anybody to get sick.
I know nobody wants to get sick, but we are at a point that when is it going to be a safe time that we know that nobody will get sick? There's never going to be that time. But this is something we are seeing a downward trend in this area. It's a good chance to see, and if we do see some people get sick, we do see a rise, and we can shut everything back down again. But people want to get back into a normal sense of routine, and right now we are seeing a downward trend. We're seeing cases, not as many cases coming out. So, in my personal opinion, when is it going to be safe enough that we don't have any chance of anybody getting sick? That's never going to happen.
At our last meeting, I'd spoken about possibly not traveling, and if we could possibly do that. We also talked about spacing in the stands. I've even talked to people about possibly doing like they've done for many churches, to drive-in. You can actually see the field from your own vehicle. You never get out of the vehicle, the child goes out. If we are adamant about maintaining distance as much as we possibly can, if we do have enough children to get 2 to 3 teams, maybe we just keep that in town. That's a possibility we can look at, but we won't know until we get a head count of how many kids are going to be in. The traveling situation, I know a lot of teams aren't traveling that traveled last year. Maybe they're going to play town this year and we'll have a greater amount of kids, which that's something we'll have to see how it goes. But we need to be, as a council, doing what our citizens want to do. This is a voluntary thing. Nobody's forcing anybody to do anything, and that includes attending the games. Just because my son has a baseball game, that doesn't mean my parents are going to go to every single game because of the health situation. So I agree with some of your points. I agree with some of your points. It's a situation we need to deal with, and I think that getting back to normal is just as important as following the guidelines that are in front of us, and we just need to follow through, is my opinion.
Any other comments? If there's no comments, request a motion to approve baseball. Softball.
I make a motion to approve baseball and softball for the 2020 season, or summer.
Second.
All in favor?
Aye.
Opposed?
Nay.
Motion passed